Welcome to 52 Questions. I'm Shannon Weber, Director of Hive. Every year, Hive answers hundreds of questions from patients, their partners, and providers. And each week in 2018, we're bringing one of those frequently asked questions to you in video format. For this week's question, I have a special guest, Dr. Derrick Butler, and I'll let you introduce yourself in just a moment. And the question that we're going to answer today is, if I'm undetectable, am I still HIV positive? So we've made a lot of videos about U equals U, which is undetectable equals untransmittable. And in clinic, we still get asked the question, even if I'm undetectable, am I still HIV positive?
Exactly. So I'm Dr. Derrick Butler. I'm a family physician and HIV specialist, and I work in South Central Los Angeles, where I serve primarily a community of color, and love taking care of patients with HIV and helping to bring them to health. And I do have to get this question also, Shannon. Mm-hmm. So the question again is, if I'm undetectable, I'm taking my medicine, I'm undetectable, so do I still have HIV? It says undetectable. Well, it's really important to understand that. Remember, undetectable just means that when we do laboratory testing of your blood, we can't find the virus. The virus it's not detected in the blood, but remember, the virus is still hidden deep in cells in the bone marrow and in the lymph nodes. So the virus is still there, but we can call it suppressed or in some ways inactive because of the medication, antiretroviral medication that you're taking. So you're always HIV positive. Sometimes patients ask, well, can I take another HIV test? And it should be negative, right? I'm undetectable. And I say, no, that HIV test you took for diagnosis will always be positive because it's not testing for the virus, it's testing for the antibodies your body makes when it knows the virus is in the body. And that will always be positive, unfortunately. But the viral load test, which looks for active virus in the blood, can definitely be undetectable if you're taking a treatment and it's working really well. But the virus is still there, but definitely being controlled if you're adherent to your medicine.
So I'm hearing you say you're undetectable. You can't pass on HIV because it's not detectable in your blood, but you're still living with HIV. And so until there's a cure, once you have HIV, you would always have HIV.
Exactly. And again, a great point to remember that when it's undetectable in the blood, you're really not going to transmit the virus. We're all really positive and hopefully we'll have a cure soon that will get rid of and take care of that virus that's hidden deep inside. But until that time, the HIV is still there.
All right, thank you for joining us and have a great week.
You too. Bye.